Hello and welcome to yet another episode of Meditalk. Today we have with us Dr. Mukesh Patekar. He is a senior consultant in Fortis Hospital. And Dr. Mukesh, welcome from Vrozart Health.
Hi,
Uh,
thank you.
yes. So I'll briefly introduce Dr. Mukesh. He is a senior medical oncologist with more than 9 years of experience in the field of medical oncology. And he has expertise in treating solid tissue malignancies, hematological malignancies, stem cell transplant, and as well as pediatric malignancies. He is well versed in the administration of chemotherapy, hormonal therapy, targeted therapy, and immunotherapy and palliative care. Sir, I welcome you on behalf of Vrozart Health. And so today, our viewers would like to get insight of a few questions that I'll ask from their behalf. So, sir, first question is, what is the current scenario of cancer treatments in India, and technologically, how advanced we are?
Hi. First of all, thank you for inviting me for this talk.
Right.
Basically, cancer is going to be number one non-communicable disease in Indian population or in Southeast Asia.
Right.
And because of what I have seen from 2013 till now, the
Mhm.
number of patients detection rate has increased tremendously.
Mhm.
And regarding the treatment options, as far as India concerned, we have all the cutting edge technology and all the diagnostic modalities, all the available molecules, whichever get approved in USA, that they can be imported or they can be available in India. So technology where we have everything that is needed for any cancer patient,
Mhm.
and there are many centers in India. They can cater the all kind of cancer.
Great. So it means we are technologically well equipped to handle any
Yes.
type of cancers. It's very good to know, sir. Now, I would like to ask one question from our international patients' behalf as to from which countries most of the patients are coming and what type of cancer is prominent in those countries.
Um, Predominantly at our center, like I work at Fortis Gurgaon,
Right.
we got a lot of patients from Iraq. First of all, Iraq, followed by Uzbekistan, Mauritius, and Africa. Africa is predominantly from Kenya,
Mhm.
Kenya, Tanzania, Ethiopia.
Mhm.
So in the each country has different cancers. Like in Iraqi patients, we get colorectal cancer are more prominent. So, and the other thing is from Mauritius, the hepatobiliary cancer like pancreas,
Mhm.
pancreatic cancer, gallbladder, and cholangiocarcinoma, they are common.
Okay.
And in Africa, the pattern is similar almost. So, what we see in those countries is different. What we see in our country, we do get oral cavity cancers and the lung cancer. They are more common.
So is
So,
it
but this is the
because
only.
of use of cigarettes or addictive pan masalas and other things
Yes.
right, we are getting more
Yeah, but see,
overwhelming.
there are see whatever the colorectal cancer are there or GI cancer, they are related to food habits specifically. Those in non-vegetarian, they are taking a lot of red meat and also there is itself a risk factor which is proven, and there might be some inherent in their geography problem over there that
Right.
might attribute to more number of this kind of tumors.
Correct.
Like for in India, we know that tobacco has 21 different type of cancer they can be associated. If
Right.
you talk to our Indian subcontinent, then we have oral cavity, head and lung cancers.
Okay. So, sir, now I would like to move on to how Corona has impacted the treatment of cancer patients. Can you shed some light on this?
Yes, yes. So I will speak on two parts. First, for Indian part or some Delhi limited, and then the internationals.
Right.
Basically, the corona is impacted in a big way. First of all, the patients were supposed to travel for their definite treatment to nearby places. They are not going there. People are afraid of going to the taking treatment, or they are just waiting to end the pandemic, which is not happening. So
Right.
many early stage cancer or they are treatable, curable cancer now have become stage 4 cancers.
Right.
So that is the one big part. And a lot of and because of economy is down, so a lot of people have lost their spending capacity. So many people have opted to take treatment whatever is nearby, or they simply opted not to do anything. So that is the one thing has happened in a big way. Regarding international patients, because of travel restriction, they are not coming, or sometimes India is having a lot of cases, then country is having not, then it's reflecting reciprocally. So those people also suffering because unfortunately facilities are not available in their countries also.
Right.
So Corona has negatively affected the individual cancer patient, their family and all.
So, according to you, it's just because of the delay that has happened. The cancer moved from stage 2 to stage 4. It has become more severe, right? Correct.
Yes.
And, sir, how a doctor knows that patient is having a cancer? Can you explain a little bit?
Basically, the most important factor is the patient. What patient reports. Like in female, like if someone develop breast lump, then it is a telltale sign that there is some abnormality, and we have to check it. That is how we can detect. Sometimes people don't give attention to their weight loss or some lump, or they just feel it's okay for them. So we can have direct leading question: is there any lump? Is there any significant weight loss? Any like in colon cancer, the blood in the stool, it is black color stool. So we have to ask cancer director question. Like for the oral cavity, we can ask, is there any ulceration or something is there which is not healing? So this is how we can ask the question, and we can detect the patient might be having cancer.
That's really a useful bit of information, sir. Now, I would like to ask, in which stage cancer is curable, and what should be the treatment plan according to the stage?
Basically, the cancer has 4 stages, stage 1 to stage 4. Technically, stage 4 is not curable in any age group, any patient, anyone. So we can, in stage 4, our approach is to give palliation to the pain, quality of life, and then increase the life by some years. Stage 1 to stage 3, we can say curable. But if you go from stage 1 to stage 3, the success rate varies. Like stage 1, we expect highest cure rate as compared to stage 3. If it is and the cancer treatment varies from surgery followed by adjuvant chemotherapy and with or without radiation. So we need all the 3 modality, or at least 2 modality, to get cure in stage 1 to stage 3.
Wonderful. And sir, after chemo, what is the success rate of survival till what has been your experience?
See, success is depends upon the stage and the kind of tumor. Okay, all the cancer are not same. Right. If it is speaks about the lymphoma, then they are curable, even they are stage 1 and stage 2. Right. Certain like breast cancer or some they are cured, but there is no definition of cure as such. Okay. So we can say some people are living with 5 years with lymphoma, then we can say the patient is cure of lymphoma. Same with the breast cancer, patient can relapse after 10 years, 15 years. So it's a technical term, but we can say that the patient, the probability of living for 5 years, then it's good with the early stage cancer like breast, lymphoma and other cancers like colon cancer. Correct. So basically early stage is the most important thing to transfer into the cure and success.
Right. And is radiation therapy successful for patient treatment in cancer?
See, radiation is not the primary modality in most of the cancers. Radiation is the definite therapy in it is there, roll up there. And in certain cancers like breast cancer, if they have nodes in the axilla, then radiation is required. Some cancer of the stomach or in the pancreas, if they are node. So basically, role of radiation is to adjuvant. It is not the modality. Just like the chemo is not the modality. So it's a multidisciplinary approach, most of the cases.
Correct. Sir, at the end of it, I would like you to give some advice to our viewers how to prevent cancer and to how to manage it. You know, it's always prevention is better than cure. So, yes. How do our viewers, prevent cancer?
My message for viewers is like that. Like for females, for female audience, the breast cancer, cervical cancer, they are and there is a definitive role of screening. Like for those women after 45 years of age or 50 years of age, they should do annual mammography at least to detect the early breast cancer. They
Right.
can go for the pap smear plus HPV DNA testing every 5 years to prevent the cervical cancer. So
Mhm.
these are the screen detected cancer and they can be prevented. In males, there are no screening program as such because it is not found to be effective. But still, if the patient is elderly, like 70 years of age, and then we can monitor his PSA.
Mhm.
PSA testing for lung for the, if someone is chronic smoker. In
Right.
that, we can do low dose HRCT if the suspicion of lung cancer is very high.
Right.
And simply any node, any weight loss that is not intentional,
Mhm.
any blood in the stool or any abnormality which is not there and it is not doing away with the simple treatment. So then need to have a suspicion of background key everything is fine or not. So we can do that like that.
So I think our viewers are much benefited from today's advice that you gave, and we look forward for more sessions with you, sir. And I wish you all the best on the behalf of Vrozart Health. Thank you for joining us. Thank you, sir.
Sure, sure. Thank
Thank you.
you. Thank
Thank
you.
you.
Take care.
Take care.